Hello, Dallas. Hello, everyone. Good evening, good afternoon, and good morning to all my global viewers. And thank you so much for joining for today's live Facebook and YouTube program. And welcome to my show, Global Cup Shop, an Asia News presentation. This is your host, Anu Benikati, and taking you all on an exciting journey every time with me to meet extraordinary guests in every episode of every week. So thank you so much again for joining, friends. Today we are, as usual, that we are going to have a very interesting topic that I'm going to be taking you with on a discussion. As I'm sure that you might have heard, speech language therapy is a very special subject that is only that parents who go through that they're the only one who knows about it. So there is a very interesting thing that I want to share. Whenever this topic comes, that I've heard many times people talking about a very famous scientist, Albert Einstein, because, and I believe the interesting story goes that and about him, that I believe his parents were very worried about his speech and language development. I don't know how much it is true, but I mean, they say that there is no evidence or proof that he had a learning disability, and that he also was late in in talking. So why I'm saying this one is because sometimes it is not true with every kid, but it is not false either, because diagnosis is extremely important. Whether it's true or false, it is for the best interest of a child, that it's extremely crucial for a parent to know what is exactly going on with the kid, because the it is very common. Speech impairment is a disorder when a person has a problem producing speech, talking and sounds, especially, and correctly and fluently, or trouble with their voice. That also could be a reason for their disability. And there comes also the language disorder, may occur along with this one, the speech, when a person has a trouble understanding others, or sharing the thoughts, ideas, feelings, and also then having a trouble completely expressing themselves, fluently, talking also in a language. So as we all know, how crucially important communication is, whether it's a child or an adult, or a young adult. The effective communication plays a very important role in everyday life, or of our life. So according to the source, just where I am, like here in USA, 5 to 10% of Americans may have a speech disorder, and most of them, gets diagnosed in their as early as the first grade. Like a lot of children go through that. So, friends, that is what is today's topic. It's very important for parents who are going through this, who are in this shoes and in this situation. I hope today's show will bring some light and answer their questions they may have. Feel free to just send us the question and post it on the Facebook, so we'll be happy to answer with an expert. So even though the speech problems is very common in the childhood, does not mean that it does not exist in adults. So we'll be talking about that as well. So our today's guest is a certified brain injury specialist, and also she is an audiologist and a speech language therapist and a pathologist. So she has provided her services not just one country, but several countries. So that is what makes her experience very valuable for globally whoever is watching. She's providing her services currently at Neurogen Brain Spine Institute, Mumbai, as a speech language pathologist and a coordinator for the speech therapy department. Also, she's a Spurs Child Development Center. She works there as well, and Podar Jumbo Kids Early Childhood Center. So she actually provides so many of not only just her services, she also works with the orphanage in Mumbai as a consultant for a social cause, which is a very honorable services and contribution to the community. And the main aim of this contribution is to train children on the autism spectrum through behavior management, and structured teaching. So, friends, some of her accomplishments to talk about are: she received an acknowledgement for her presentation on acoustic analysis of voice in individuals with a different prakriti at ISHACon. That's a very well-known conference, as you all know, and also her article published in an Indian Ayurvedic medical journal. So we have a very, very, wonderful expert on this topic. So it is an honor to have her. So I would like to invite Miss Sneha Ambekar, all the way from Mumbai, India, to my show Global Gupshup. Hello, Sneha. How
Hi,
are you?
hello. Hi, Anu. I am good. How are you? Thank you so much for that wonderful introduction.
Absolutely. You're welcome. It's a pleasure and honor to have you. So we are so excited. All my viewers are waiting. And thank you so much for joining so early in the morning. And this is really, must be tough for you so early in the morning.
No, definitely not. I think we begin much more earlier than this. So this is
Good,
good.
good,
This is a
good.
normal early morning for me.
Early morning. Wonderful to know that. So I think we're all excited, and I know we're going to talk about a very important topic and a very unique one, and also something that all parents have. Like many parents, I should say, that have gone through this one and seeking help. So before we begin our conversation, I would like to ask you that, just we want to know a little bit about yourself. So tell us about yourself, where you're from, and education, and like how you got here, and in the current, the expertise. So take us through
Okay.
that.
Okay, so hi everyone. I am Sneha Ambekar. So basically, I am currently working in Neurogen Brain and Spine Institute in Navi Mumbai, India, and a lot of other institutes like Sparsh and then Podar Jumbo Kids. That's a school in Mumbai. So that is where I consult for now. Like, okay, so how did I get to this profession? Is it's a big story, a little bit emotional touch to it. So basically, uh, yeah, Anu. So I just wanted to share this because uh, I keep telling this to everybody that there was when I was young, I had been to this orphanage, and my mother was a social worker, so she
Mhm.
used to take me to these orphanages, and just to do some contribution from her side. And then that is when she wanted me to do this. She always wanted me to. You need to do something different, so
Right.
that is why. And everybody does it for the neurotypical individuals, but
Mhm.
there has to be something for these special needs kids also. So that is why my mother has put that seed in my head, and
Right.
then that is how I thought about getting into this field. And slowly as and how I grew older, I think that was much more like, I think that was the motive, and that is how I become like, I was very, very sure that I have to do this. So that
Mhm.
is how I came into this speech and language pathology field.
So
So
that was
yes,
your inspiration, that your mom just, like that was the first incident. So while growing
yes.
up, or in a high school or in a college, have you done any volunteerism or just something to, get yourself like tested, like whether I fit into this profession, or like how well that I can really, because it requires a lot of emotional attachment as well as a perseverance and emotional, that this is a very, very how do you say, like a requirement of the patience with the,
Yes.
the person that you're working with.
So when I was in, I think when I was in college, I think somewhere I thought that I need to relate and I need to talk to people like
Right.
directly. So I don't want to do this table desk job and finish at 5 and leave.
Behind the
So I always
screen.
wanted. Yes. So I've always wanted to connect with them and know their problems, and if I can counsel. Counseling is my like my
Right.
forte, I would say.
Oh,
So
wow.
I love talking to people, and that's how I have good convincing ability, I feel. And that is how I wanted to be. I was so sure that I need to go and do this. And
Right.
this is something that I can meet a lot of people, and listen to them and maybe help them in all possible ways,
Right. Right.
especially
Oh,
when there is this
absolutely.
sad picture. Yeah.
Yes. So, well, that is good to know, because that is absolutely needed. And I think when like when you felt it as growing up, I think definitely chose the right profession then. So like let me ask you this one, because I know that speech language therapy is a very how do I put it, is a very sensitive and requires, like I said, a lot of perseverance, and due to its connection with the neurological disorder, because you already know that person is not normal, that cognitively, and also something is not very right, and you're
Yeah.
trying to fix it. And could it be an autism, or like or due to ALS, or even more, some of those motor neuron problems, anything that to speak.
Yes.
So, can you briefly tell us your experience that with the child, like to even just on the first approach with the like children, like as early as young as 5 to 6 year old, or a young adult, or like a grown up adult? How do you approach them? How difficult it is?
Okay, so now that I'm working with Neurogen, I have come across with a lot of kids with this neurodevelopmental problem, that's autism.
Mhm,
Other than this, there is other disorders like cerebral palsy. Then there is aphasias. Then there are Parkinson disease and a lot of MND and ALS patients. And
mhm,
everybody, I think, the most common problem that everybody has is speech and language. Okay,
mhm,
and when I come to adults, there is an added disorder, that is dysphagia, that's swallowing difficulties. Okay,
mhm,
so when I talk about children with autism, the youngest age group that I have come across is like 18 months, 15 months to 18 months. So
mhm.
that is when I guess the parents have come up with at very early ages, saying that my child does not talk. So
Right.
that's how when like that is the major complaint, and that's how now when I say speech and language problems, so speech is just not like, yes, definitely speech is the end product, but there are a lot of other factors that are going to take me to speech. Okay, so for example, so when I say my child cannot talk or does not talk age appropriately, he
Mhm.
has problems with attention, he has problems with sitting tolerance, not able to sit in one place, or maybe
Right.
cannot socialize or does
Right.
not play with his peers. All these problems are something that they are like, they do not focus in directly on that, but that's how we diagnose.
Right.
So
So
so that is
is this
how.
the same with the like a young child? Because I was going to ask you that one in the later, like we can go over the details, but like the comparatively, which one is more difficult? Is this like a young child or the adult? Because the reason I'm asking is a child that they may not be able to express themselves, but then as an adult they have a so-called, either they are in a denial or some kind of a like that not ready to accept. So it must be like, which one do you feel is more difficult?
Uh, Actually, both are equally difficult. One
Really?
is when the child has not acquired language at all, and it's a clean slate, so that I can write afresh on the page. But the sad picture is, I think the language is already acquired, and because of some external incidents, there's a loss of language or speech for
Mhm.
that matter.
Right,
So
right.
that is, so everything is, like, both situations are equally difficult, but
Mhm.
when it comes to child, it's definitely much more difficult, because it begins with breaking out this like
Nice.
breaking the ice, I would say. Yes, yeah, to tell the parents that your child is suffering or has this kind of a disorder, and it's very difficult for like to say that he's going to fall in the spectrum. If I say talk about autism, he's going to fall in the spectrum, autism spectrum,
Mhm.
so it can be ranging from mild to severe.
Right.
So the parents come up saying that just he cannot talk, just keeps on running, but then there are reasons to it, and then why he can't do that, and what problems he's going to have, like
Mhm.
as and how he grows up.
Right,
So
right,
I
right.
feel both the situations are difficult.
Correct, correct. Oh wow. So that's like it none of the parents want to hear that, right? It is very
Yes.
difficult to convey that,
Yes.
you know,
Yeah,
uh
to convey and to accept. So to
right,
accept as a parent, my child does not fall in a normal range is
right.
very difficult.
Right,
Yeah.
right. Yes, I mean, I can imagine as parents, like we do not want to hear that. We do not want to accept certain things, especially about your children. That when you're saying that, okay, this is not normal. So, because like we do know that like as a child that we accept it. I mean, expect at certain age that they talk sweet, cute little words. Even though they
Right.
cannot say that immediately, like a spaghetti or a chocolate, something like that, but we still want
Yes.
to hear something. So how do we know, like how one can recognize even like a small tiny that baby talk, it doesn't
Yeah.
come out. You said that you already treated like a 18 months old, so how do we know that this specific child is going through some kind of a speech disorder? Are there any specific symptoms that they should be watching out for, or like they should get concerned about certain behavior?
Yes. So yes, if I now I'm considering autism,
Mm-hmm.
and definitely there are behaviors that are very significant. Oh,
Mm-hmm.
but the thing is that we see all these behaviors only after 1 year, or maybe 12 to 15 months of age, because when the child there are these symptoms, say delay in developmental milestones, so it can be motor as well as speech and language milestones. So
Mm-hmm.
sometimes parents say that that my child did not walk by 1 month of age. By
Mm-hmm.
5 months to 6 months of age, he should be starting to babble. So
Mm-hmm.
that's the baby words, ba 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 ba. That is what the child needs to do. But this is
Mm-hmm.
not seen in a lot of kids with autism.
Mm-hmm.
Plus, by 1 year of age, he should be talking his first words, and those are meaningful. So maybe naming the family members, all of these. But this is not seen again. So
Right.
this is when parents have this, questions that why is my child not talking even at 12 months of age, and that
Mm-hmm.
is when they concern, a pediatrician or a family doctor, and why is he not talking?
Right.
And then that's how referring patients come into picture, and diagnosing the child
Right.
to whether he has autism or he has some other speech language delays or disorders. That is
Mm-hmm.
when we need to find out. So
Okay.
again, other thing is that he does not look at me. So when I'm calling, he does not respond to my name call. That
Mm-hmm.
is what very common complaints that parents have. And
Mm-hmm.
he does not look at me, he keeps looking at the spinning objects,
Mm-hmm.
he spins himself,
Mm-hmm.
that he fidgets with his fingers, and there is continuous wiggling of fingers,
Right.
w seating, then toe walking. All these
Mm-hmm.
are the first symptoms that you need to check for when you suspect autism in a child.
Correct. Correct. So it is not just the autism, and like could it be any other issues that are going on? Like for example, that the hearing issues or something other than that, like any other
Yes.
kind of things.
Yes, definitely. So suppose when I other things are, my child does not listen even if there is a doorbell ringing, or if
Right.
there is this cooking noise in the kitchen, he just does not listen. Or maybe there's this crackers noise of the crackers. Only then he responds to, and that is just the awareness about the sound, just gaze. That is
Right.
when, but still there is the parents do not know that if he has a problem or no. The other things are maybe he doesn't walk, and that can be because of some reasons that may have gone unnoticed, like
Mm-hmm.
having fever, or just a fall from a bed. All these reasons can also be reason for
Mm-hmm.
some issues in the development or
Right.
in the brain, I would say.
Okay.
So that is when we need to check for everything,
Mm-hmm.
and to find out what exactly it is. So if it is fever, it can lead to high fever can lead to seizures. Seizures, yeah, and it can also cause cerebral palsy, which has a lot of motor developmental issues. That the child cannot walk. There is drooling that happens. The child cannot swallow properly, or has coughs or choking while eating food. He, even after 1 year, 1.5 years of age, he's still on the liquid or the semi-thick consistency of diet, and
Mm-hmm.
is just not able to chew properly, or there's
Mm-hmm.
no closure of the lips as well. So that is something that you need to look for. And hearing issues, and even after like for like 2 years, 3 years, 4 years, there is a certain age that where a child needs to establish and develop all the sounds. Even up to 5 years of age, if the child is not able to speak a certain sounds, then we
Right.
say that the child has misarticulations. Yes,
Okay.
definitely it was baby talk first,
Mhm.
and then later on the child needs to develop
Mhm.
the sounds appropriately. But even after 5 years of age, if the child is going to say to for a ro sound, then definitely
Okay.
that's a problem. Yeah,
Okay.
so
Okay.
that is something called speech production issues.
Speech.
So
Okay.
yeah,
Something
so
to do with their voice producing difficulty or to come from.
voice. Yes, definitely the child has voice.
Mhm.
Voice is when like if the child there's no voice, even if when you're coughing there's no voice, or maybe there's this hoarse voice.
Okay.
There are a lot of the quality of the voice is hampered. It's a little distorted, or
Yeah.
harshness in the voice. Breaks in the pitch when you're talking. But
Mhm.
mostly there are other reasons to it, and mostly the voice disorders as such is seen in mostly in adults and
Mhm.
teens especially, and a lot of other professions like sports and all, where there's a lot of voice use. There is
Right.
where you can there's this voice disorder. But in children,
Mhm.
mostly it's a speech and language, so
Right.
like that it doesn't understand, and that's why he doesn't talk.
Right.
So that
Right.
is how it is.
Well, like that brings me to another question. Just to curious, as that the children. It doesn't have to be. Is this genetic or is this something that is acquired? Or like sometimes we all hear a very horror stories about that. The caretakers or abuse or some kind of a things that is like the generally that happens. God forbid, but when it so does that scare a child and is there a possibility that can cause this kind of a disorder by any chance?
Yes, definitely there are reasons to these kind of like these reasons for speech and language problems. For example, yes, a lot of parents, the dads especially, they are a little strict. And if you see Indian families, the dads are the more dominant one in the family, and then they are a little, what do you say, the villains in the house, in most of the house, not really, but
But
then yes.
let's call them bad cops.
Yes. Yeah. So then that is when I think everybody, even like me, I am scared of my dad much more than what I'm, to my mom. So
Mhm.
then that is how it is, in all the families. And when it
Right,
comes to like, why are you not talking? You have to talk, 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 talk. If
right.
this is the
The pressure.
pressure,
Hmm.
yes, may lead to not talking at all, or so like okay, let's talk about autism. There's no specific reason as to why autism is caused, but
Hmm.
then when you check with the history with mothers, there are a lot of things that you see in common. That is, the firstly is the mother conceived at a very old age, or not old age, a little, after 30s maybe,
Right.
or yeah, so maybe there's a consanguineous marriage. These are the factors that are seen very, very, very common. Yeah.
Right,
And
right,
then there is delay development. So
right.
there's nothing specific, but
Mhm.
only and only delay development.
Correct.
The other thing is my child was developing fine until 15 months of age, but then later on he started regressing. This is something that is seen after every alternate kid has this complaint.
Hmm.
So that is something you see very much in common. Other
Hmm.
than that, if you say abusive parents, if that is the case, that may lead to either there's no development of language, or there are other issues such as stuttering, with
Right.
stammering.
Stomach.
So
Right,
you,
right.
yes, yes. So the new term for stammering is stuttering now.
That's right.
So
Okay.
that's, yeah. So that's how stuttering comes into picture. Like he's not able to talk fluently, or maybe
Hmm.
there's this pressure. So this
Hmm.
is how the stuttering can be diagnosed. I know there
Right.
are factors for stuttering as such.
Hmm.
These are the reasons I feel. Then there are these medications, but when you see, like I've seen a lot of PET scans and
Hmm.
all you can see is there's no major anatomical changes in the brain, but what you can see is the language areas are damaged. That is the more common. That is the only PET scan that you see.
That's
The language
damage.
areas are common. Yes.
Okay. So once you start the treatment, I would say like that early age or even a little, the appropriate age to diagnose these kind of issues. So what is the amount of time, or the, like, is there an approximate amount of time that you can say that, okay, so there is a little bit of a improvement is happening, okay, so, because all parents are very eager and curious, like, when is my child is going to speak, or just, like, it's going to get better. So is there a time frame?
Um, See, when I say speech and language, I am not prescribing medications over here.
Yes.
It is totally to deal with behaviors, totally to deal with the child's mood swings, the ability to learn a particular thing, and how
Hmm.
fast that learning takes place. And
Right.
definitely, age matters. Like
Okay.
suppose the critical age of learning is around 6 to 10 years. That is
Right.
the fastest anything can be learned. If for
Hmm.
this is for everyone. So then, when so suppose there is this problem with speech and language, if it goes undiagnosed for a lot of years, then
Hmm.
definitely I would say there is a difference in improvement for those undiagnosed kids as compared to the early diagnosed kids.
Hmm.
So
Hmm.
that is why we always focus on early intervention. If you suspect anything, like it's good to see a doctor or a pediatrician or whatever concerned doctor basically
Right. Right.
to find out if there is a problem.
Right.
So yeah, so that is
There are,
how.
there are also, like, connections, I believe, right? Like, that sometimes, depending on the different situations, to be diagnosed before you even they actually to approach you as a speech language therapist. So there could
Yeah.
be several issues, like, if the physical, psychological. So do you think they are connected as well?
Yes, definitely they are connected because see, the parents do not know what exactly is a child going through. All you
Uh-huh.
can say is my child doesn't talk. So
Right.
when you approach a pediatrician, the pediatrician is going to follow proper order of referral. So the
Hmm.
first thing that you need to send them is to a psychologist
Uh-huh.
where they are going to diagnose him. So diagnosis is very important because the plan of action or the line of treatment changes according to the diagnosis.
Diagnose.
So that is when you will have to go through a psychologist for a proper diagnosis,
Hmm.
especially in speech and language and autism kids. So
Right.
just to check for the severity range because
Hmm.
you see a lot of differences when it is a mild autism to when as compared to the severe autism. So
Hmm.
then and then later on there are other things also that the child is not able to do the activities of daily living, or maybe not able to talk, not kick a ball, not able to climb stairs. All these
Right.
problems come into the picture. And then you need to find out if there's muscle tone issues or there is some issues with the
Got it.
bones or yeah. So everything has to be checked, and then there's this team of people work together for one particular child, and that has psychologists, then there is physiotherapist, then there is occupational therapist, speech therapist, and special educators
Wow.
at later ages.
So
Yeah,
many
so
different ones to
so
help with.
many.
Wow. Right,
Yes,
right.
and it's really wonderful. Like right now, when I'm working with my organization, it has got a team, and it has you can see like if there is a child going just for physiotherapy outside, when as compared to the team work, you
Mhm.
see definitely there are changes. Changes, not changes as such, but then there is a difference when you work as a whole.
Oh,
Like
right, right.
you consider the the brain, the bones, the hands, speech, tongue, everything together, and you definitely see much more differences than when you focus only on one particular thing.
Right,
So
right.
the team is like teamwork really helps basically.
Helps that, at least it will connect everything, and it will give you a clear picture, and then where the actual diagnosis and the right treatment should be given
Yes.
to that child, that
When I
whatever.
talk yeah, so when I talk about cerebral palsy, so there
Hmm.
are a lot of physical issues that are involved. So
Right.
the child is shrugged, not able to sit properly, there's no proper posture. So
Hmm.
where is the speech going to come from? So when, if there's no proper posture, like, see, if you, I'll just, give you this example. When you're sleeping, when you're crouched or shrugged, would you be able to talk properly? No. So the cerebral palsy kid, they are always in this kind of a posture. So there is this no expansion of lungs, which can, which where he can inhale a lot of air, and
Mhm.
then air is something that is required for speech production
Right.
basically.
Right.
That doesn't happen, and
Mhm.
that is why to get a cerebral palsy kid in a proper posture to make him produce a sound is really important. So
Important.
that is how,
Mhm.
yeah, so for CP kids,
Mhm.
physiotherapy plays a very very important
Pause.
role, and
Right.
definitely when you have a proper posture you're going to have a proper lip seal, and then there is
Correct.
no drooling, then there is chewing, and then there is
Yes.
proper soul. So it's everything
Mhm.
is related basically.
Related
So
to it.
and
Right.
definitely when he is going to eat, he's going to have proper nutrition, and then
Mhm.
definitely the other development. So that
So
is
all the
how.
nutrition also actually play a very critical role in this one. Wow, that's amazing. Well, thank you. That is a wonderful information, especially cerebral palsy. Yes, that is one of the issues also for that plays a very crucial role. When it comes to communication and speech. So, well, talking about the autism, let me ask you this one. Like, and how hard it is to just convey this message to, like, for example, that you find, and then I'm talking about a severe autism, and say that,
Hmm.
okay, parents, that you have to tell them that your kid is suffering from a very severe autism. And my question is not just that since you handle a lot of global patients, like from
Hmm.
a different country, so do you see any cultural difference that accepting this fact from each parent?
Yes. So you see, so actually breaking the ice for severe autism is like that is not the case actually. Like you cannot directly see the severe traits, but yes, you see drastically different social skills
Mhm.
in mild and severe patients. So
Mhm.
severe are they are completely isolated, not wanting to interact with anybody as such,
Mhm.
that they have this isolated play behaviors that they show.
Mhm.
Can you repeat the question?
Okay,
It just
I was just
just
asking you. So, like, when you say that, like, okay, so this, due to the autism, this kid is not speaking because this is a speech disorder that your child has due to the autism. So, you handle, like, parents from a globally,
yeah,
like in different
correct,
countries,
correct, correct.
because of the cultural difference. Do you see any different accepting
Yes.
strategies that you come
Uh,
up
the- so when it comes to India,
with? Right.
like the this acceptance issue is a lot in India because there are a lot of parents who come from the remote areas of India and they have absolutely no awareness about what autism is. Like,
Right.
why is my kid even behaving like this? Nothing.
Why
There's
my
no
child is
purpose.
not
He's
talking?
just lazy. Yeah,
Yeah.
no, my child is not talking. He's just lazy. He doesn't want to do that. He's a little stubborn. That's it. Do phatke laga denge, all done. That
All
is
done.
how. Yes, so that's how a lot of parents have these kind of understanding of a problem basically.
Mhm.
But whereas when it's compared to other like outside India or international patients,
Mhm.
I think they are much more aware about like this autism, especially they are more aware about autism and the problems linked to it.
Mhm.
So culturally, if you see that, eye contact, if I take eye contact as an issue, like which is very common in autism,
Mhm.
you see that India has got this kind of what mentality that when you're talking to adults, you're not supposed to look at them or look into the eyes and talk, and that's kind of a disrespect. But
Disrespect.
whereas,
Okay.
yeah, but
Okay.
whereas you see other
Country.
countries, whereas say American Africans, they have this look at me while you're talking, look at me.
Mhm.
That's how they they teach the child, and that's
Eye to
completely
eye.
okay for, yeah, correct. So that's completely okay for them, but it makes a difference. So that is something where culture plays a different plays
Right.
a role,
Mhm.
and
Wow.
that is something different.
Right.
Plus the way you treat your kid. So
Mhm.
outside it's like you can't hit your kid, you can't raise your voice at your kid. So that is how something the government has come up with this rules for them, which is a good rule, I would say, but to some extent. Because I feel, yeah, when it comes to Indian parents, I feel that pressure sometimes help also, because yes, I have no choice. Mama has asked me to do this, so that is when I feel you have to. You're under pressure. You tend to do a lot of things.
Right. 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 Well, when we're talking about that one, like I should ask you, like, this is a very interesting way of approaching, because I know that, like what you mentioned, that spanking is not allowed in a different Western countries, and then which is a probably a one of the way to discipline kids in Asian countries, and especially
Yes,
South Asian countries, that they follow all the time, including teachers and parents, and
yes,
it was accepted, I should say. Maybe, like, it's probably not now. So
yes.
I think it must be very difficult for a child to understand, like, which one is the right and which one is the wrong,
I know.
you
Yes, correct.
when it comes to just discipline comes from teachers and parents.
Yes, yes.
So
The child just doesn't understand what do I listen to? This one or this one?
right, right, right. Well, let's talk about a disorder itself a little bit in detail. So, let me ask you, what are the major, like, causes for this kind of a, speech disorder? Does it comes, like, must be something that actually can trigger that, right? So, what are the major forms of it?
So basically, what is commonly seen is firstly lifestyle. Lifestyle is something that is affecting. Earlier there was, you see a lot of parents saying that we did not have these kind of issues, at our times. But right now you can see a lot of that because of the modifications that we have made in our lives. Being a little careless, I would say.
Mhm,
Then there are, this is one thing, the lifestyle, but then there are these genetic mutations. There are also articles on genetic mutations that happen.
mhm.
Also, there are these medications that directly affect the
Baby.
language areas in the brain. Yes,
Mhm,
and leading to seizures. Sometimes seizures just go unnoticed. There is this. What do you say? There was nothing. He was just unconscious for a few seconds, and then he was all okay. But then, what exactly the problems have caused in the brain, that is just not diagnosed, or they haven't just ruled out if whether that did any changes in the brain or no.
mhm.
And so that is something, these are the issues, and the age of conceiving, I just like
Right.
I said before.
Early
uh,
gestations or something
yeah,
periods.
so
Right.
yeah, so that is how these may lead to problems in developing language
Right.
or speech.
Yeah, I
So
remember you also mentioning something about the, like, while we were talking earlier, like, during our discussion, that RH factor or something like a diabetes that also plays
yes.
very,
Oh,
yeah.
yes. That also, yeah. So if you see, the mother has undergone through some stress during the gestational period.
Mm-hmm.
So that gestational diabetes, yes, and
Diabetes.
RH,
Okay.
yeah,
Okay.
and RH incompatibility is also one factor
Okay.
that
Okay.
can cause autism, or not
Right.
autism, but can be a problem or can be a reason for a lot of other issues.
Right.
And gestational diabetes, and this stress can be, and hypertension as well
Mm-hmm.
during the pregnancy. So
Right.
this is something that you see very commonly
Right.
uh, when you're taking history from the parents.
Right, right, right. So this, let me also ask you that. So this, like, let's say that, apart from the childhood, so this can happen at any age as well. Sometimes is this like something that can appear, like
Autism.
adult? Yeah, no, not. I mean the speech
uh,
disorder, like, that sometimes.
uh, Yes, definitely. So if it is a developmental issue, then you see the characteristics right from the
Yeah.
initial stages. But
Right.
when there is an external, incident that has taken place, like
Uh-huh.
maybe an accident or a traumatic brain injury, then
Mhm.
definitely you see a lot of effects later on, that after the language acquired age as well. So that is
Right,
when,
right.
so mostly in adults, so that we call it as aphasias. So
Mhm.
aphasias are something when you have a damage to the brain and there is a loss of language or speech.
Mhm. Mhm.
But you can see there are other, features, like the patient is able to understand but not able to execute.
Mhm.
Whereas in some cases they are just not able to, comprehend as well as execute the speech. So that is how see, you see that there are these differences,
Mhm.
at age, while learning language and after you have acquired language.
Right.
So definitely you see a lot of, and that's why I mentioned about stuttering. So when you are developing, if you have already acquired language, but then you see this, the kids are, if there is a other kid who has this stuttering issue, the
Mhm.
child, obviously is going to, copy the way or the pattern of language the other kid has, and then he's going to
Child
have.
is equal. Yes, yes,
Yes.
definitely that.
And then maybe if it is not cured at the right time, then it goes on increasing, and maybe then there is again peer pressure, then there is family pressure, and then it's a
Yeah, I was
vicious
gonna
cycle on
right.
and on.
Right. I was going
Yeah.
to ask you that one actually, because yes, you're absolutely right. Like, some in some incidents, like, maybe for whatever the reasons, the condition was ignored or not treated in a proper time. So, what are the severe consequences of this condition?
So basically, like if autism, you take autism into consideration,
Mm-hmm.
what you can see is there is a lot of delay in language. So the child is not able to understand even the basic things like understanding of lexical items or the common objects and naming of objects, even for that matter, family members. A lot of
Mm-hmm.
kids just do not know. Maybe they know that this is somebody who is very familiar in my house, and this
Mm-hmm.
is the safe area, the safe zone, who's going to feed me, who's going to take me out and take care of me. But
Mm-hmm.
they do not understand that who this person is. So,
Right.
relating and associating a lot of things definitely is important. And
Right.
slowly, as and how the child grows, there are going to be other problems like pragmatic issues, like higher cognitive functions,
Right.
not
Right.
understanding body language, not abstract figurative language, not
Right.
understanding logical, able to do logical thinking, reasoning, understanding sarcasm, jokes, humor, all of that. These are the major issues that the child is going to have.
Mhm. Okay. Well, yeah, I mean, like, it is not easy for anyone to just, take such kind of a condition and to deal with, especially as an adult. So, like, what are the social conflicts if you're an adult and you're facing such, difficulty in, like a speech and everything that, like what you're going to, like, for example, like you're going for a job or getting married or education, any of those things. So do they also affect very severely by any chance with such conditions, like especially communication, that's the key. And speech disorder can definitely interfere with such the social activities. So do you have any patients, like, who come and say that, okay, this is the major issue that I'm facing? So how do you treat them? I think we do have a little bit of a issue here, so probably we may want. So yeah, would you mind just logging out and then come back in? Maybe, like, I think we can continue a little bit more, because I think we do have some internet issue that's going on. So a little bit of a delay in that one. My apologies for the audience. I think it's going to take a little bit time for her to come back, um, and make this one work. Even though it's a virtual show, that we may have to kind of like be uh, like accepting for these so-called technical issues. So I'm very sure that she can go back and come back here. Um, let's give her just a couple of minutes, and then she should be able to come back, and so she will answer the questions. Okay, I think she's back. Probably go ahead and add her. Maybe she can come back in.
Hello.
Okay, now you're back, but I think your picture is. So can you turn on the video camera? Probably that you're not visible, but we can hear you.
Hello.
Okay, now you're back. I know it's a poor visibility, but at least we can see you back. I don't know if you heard the question. So can you hear me?
Hello. Can you see me?
I think we are having a technical issues, and let's give her like a 30 seconds, and then probably we'll try again. And if not, then like I would like to thank her because we are trying our best. And so Sneha, can you log back in again one more time? Let's see if we can pull this off this time. Unfortunately, the There we go. I think she is back. I am extremely sorry, guys. So I think I'm so glad that you're back. I know the technology.
System issue, yeah.
So definitely, sometimes we have to. So like I think I have to read Vandala's comment here. So thank you, Vandala, for joining. Your speech has been affected. Yeah, sure. Yes,
I
that's
know, I know.
you're
Technically affected.
absolutely right. So but you know what, actually, that I didn't mean to make the, but I was actually, but two concussions that actually resulting from two serious accidents caused by reckless truck drivers. And my vocabulary had, oh my goodness, diminished. Wow. Thank you so much for sharing such a confidential information, Mandela. We are really grateful for saying this one. And I hope, like you're such a, like a community and a social service person, that this probably is not a very happy thing for you. And thank you for sharing that one. And I hope you feel better soon. And I hope all the information that we are giving is a little bit of a help for you. And please do let us know if any of the questions that you may have that, we'll be happy to answer for you. But Sneha, if you can hear me, so let me ask you
Yes,
repeat that last question. So that I was saying that, as an adult going through such a difficult condition, and so how severely they can get affected, like whether it's when it comes to getting married, and or just to the jobs and things like that. It's
yes,
very difficult, right? Like, and how do
yeah.
you handle such situations?
Yeah, so yeah, I was talking about the issues that you face when you're in your adulthood. So basically, when
Right.
you say autism in their adulthood, there are a lot of pragmatic issues. Like, you just do not understand the social cues, or maybe the logical thinking, like what exactly you need to do at a particular situation that is
Mhm,
affected. And
mhm,
so there's a very typical thing in kids with autism is that they do not understand sarcasm. So everything that is being spoken to them is taken into a literal meaning. So
right,
there
right.
are yeah. So basically, so you like there was a case where I've come across recently where there's this girl who is 24 years old, and she was just got into a marriage, and that was, I think, that is a little personal. So maybe I think that was a little push to her, and she just doesn't understand the concept of getting married or marriage. And whatever is being told to her, that you need to listen to your spouse, or you need to listen to your husband, or the in-laws, and that
Mhm,
is what she's been doing. And so when
right.
I asked her a few questions about, like, are you happy with your marriage, she just said yes. And then, like, yeah, you might get into situations which is called marital rapes, like without consent, because she just does not understand what it should be like. And
Right,
that is these are the troubles that the autism individuals may get into.
right.
So then, even as the jobs, yes, definitely you can't do a lot of higher cognitive functions with the jobs which require higher cognitive functions. So basically, it is just you need to, like this, that is it,
Right. So very
and then,
limited, and the small kind of a
yeah, yeah,
discrimination is there. So
yes, exactly.
right,
So it gets restricted when it comes to autism.
right, right.
So that's how. But definitely, there are a lot of platforms where they are
Mhm.
giving you a chance to work. For example, there are these outlets like MACD and what do you say,
Right, right.
KFCs and all. They do let kids with hearing impaired to work on the front desk, basically,
That's very
to take
wonderful
to
to
place
know.
orders and yes.
Right,
Yes,
right.
so that is something really good, that they have this platform to work and making yourself independent.
Mm-hmm.
So that's really good.
Well, thank you. This has been a wonderful information that you have given, and I hope all of our audience have, like with the, somebody whoever was going through this and had some benefit out of such information. So like we're almost at the end of the show. So just what is your message as a speech therapist and a pathologist, like with your experience with the many different situation, many severe cases that you have come across, that like what is your
Hmm.
message, that what is more important for as a parents as well as our general audience, whoever is going through such situations?
So now that we have spoken about a lot about speech and language, I would always recommend parents to not just let the situation go unnoticed. If you feel there's a problem with your child, if he is has some behavioral issues, which is not different from the neurotypical kids, you
Mhm,
definitely need to consult a doctor. Plus,
mhm,
there are these teachers in the school who have noticing the issue that the child is, running throughout the day or not able to sit in the classroom for a
right.
very long time. This is
Mhm,
something, it's a very common complaint that teachers can, suspect and can take to a proper platform and give a proper intervention. So,
Right.
and other than just secluding the child from the normal group, you
Mhm.
need to get focus on the behavior or the problems that the child is actually facing and give him a proper treatment. So,
Mhm.
I would say early diagnosis
Mhm.
should be it's really important for everybody, especially the parents who have no understanding of these kind of problems but feel that there is a problem should seek for some help, professional help.
Right.
So that's something I would always keep telling to all my the parents, or even on a lot of where I do a lot of charity to the NGOs and everything. I
Mhm.
have this awareness meetings, and for a lot of parents.
Correct.
Yeah, so that is where I keep telling them, if you find some issues or there is something not normal happening, or
Mhm.
something diverting from the normal track, you need to seek for help. So that
Right.
is how what is important.
Right. So, is there any website that you have, like in any of the parents that, if they want to reach out to you to ask more questions after the show?
Definitely, I'll be sharing my mail ID. You can directly, I will sharing my number.
Mm-hmm.
You can directly contact me, and always feel free to contact, and I'll be there to help you out. To the
Okay.
people whoever are seeking information and have no, understanding about the problems, or maybe you feel that something is going wrong with my speech, I'm always there to help.
Oh,
Yeah.
wow. That's very nice of you. Thank you so much for your contribution and the services. And Sneha, it was excellent, wonderful talking to you. And we really, really enjoyed. And I hope our audience enjoyed. And thank you so much for coming on the show and sharing your wisdom and all the information that, that is so wonderful for all the parents and the audience to know. Thank you, everyone, for joining. And I hope this was informative, and also and the show, and you all enjoyed, I'm hoping. And thank you so much for the support always that you've been giving Global Gup Shop. And I should say that like I probably should mention one of the quote that I remember is like the what is it, the speech is our primary means of communication. If it's important, we tell people just all about it. So
Yes.
let's take that one as one of our end of the show quote. And then yeah, and thank you so much for joining. Stay cool and stay connected. And again, don't forget to join me on the next episode of Global Gupshak, always bringing you the special stuff every week. And thank you, everyone. Thank you, Sneha, for joining, and good night.
Thank you, Anu. Thank you.
Absolutely. And bye now. Take care.